All right, so Europe has now become the epicenter of the global coronavirus pandemic, according to the World Health Organization. And this comes as several European nations have recorded a surge in the number of cases and fatalities.
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China.
And Italy has recorded its highest single-day jump in terms of its death toll, with over 250 deaths having been recorded in just the past 24 hours. The country has got more than 17,660 confirmed cases of infections, and the death toll in this has now risen to 1,266. The country continues to reel under a lockdown. Meanwhile, the European Commission has promised to provide Italy with whatever support it needs. And this comes after complaints that Brussels has been pretty slow to react to the viral outbreak.
We are absolutely ready to help Italy with whatever is necessary. This is of utmost importance. This country is severely hit by coronavirus, and we all know that they need help right now. So whatever is necessary, we support. Whatever they need, we will answer.
All right, now to give us more insights in terms of what's actually playing out within Italy at this point of time that has now emerged as the epicenter of the viral infection, we're joined in by Mr. Raffaele Marchetti, who is a Deputy Rector for International Relations and also a Professor for International Affairs, who's joining us live from Rome. So, Mr. Marchetti, let me begin by asking you this. In the last 24 hours, Italy has witnessed more than 200 deaths related to the novel coronavirus infections. Give us a sense as to what is presently going on in Italy, considering the fact that for the last several days, the entire nation of Italy has been under a state of lockdown.
In order to understand the situation, you need to have a time lapse of 2 weeks. So what is happening now is spurred from activities that took place 2 weeks ago. At the moment, the entire country is locked down. Universities, schools like mine are shut down. We moved all the teaching online. Most of the shops and commercial activities are closed. Of course, not those providing food and healthcare. What we expect is that in 2 weeks' time, significant diminishing of the occurrence will take place. For the moment, the next 10 days, I mean, the shutdown took place a few days ago. The next, let's say, 10 days will be crucial and will be probably the toughest. But after that, we expect a sharp decline in the spread of the viruses.
I think it's important that you're saying that the next 10 days are going to be very crucial, considering the trajectory that the number of infections are likely to be seen. But there are reports that are coming in that the provinces of Lombardy and Veneto, the northern provinces, are very badly affected. And at this point of time, they don't even have adequate medical supplies and even ICU beds for the very worst affected.
Yes, of course, there is an issue about sustainability. You need to think about the fact that health infrastructures have been built up for a normal situation, but this is an extraordinary situation. So no country is ready to face such an exceptional state. There are two other important issues here to be considered. On the one hand, that of course you want to tackle the health issue, but you want to have a trade-off with the economy. You don't want to save the country from the health situation and kill the country in economic terms. So this is a very big challenge. Second very big challenge is international cooperation. Italy, I think, is on the right track now, and the facts will come in 2 weeks' time. But the issue is, how are the other European countries, how is the US, how are the other countries around the world facing the situation? Our impression in Italy is that at the moment there is an overlooking of the situation, an underestimation. And so the problem might be solved in some country. In China, is going to be solved soon. Korea, Italy, we expect in 2 weeks' time. But then what is going to happen to the other countries? That's the issue.
I think that's an important point that you've raised in terms of what will be the collective response to these infections around the world. But I want to talk a bit more in terms of what's happening within Italy. The population of Italy is said to be about 60 million people, and all of those people have been placed under a state of lockdown. How has this impacted the normal life for the locals in Italy? Are they even allowed to step out? How much of these restrictions are put in place? What can and cannot the people of Italy do at this point of time when the entire nation is under a lockdown?
This is bringing dramatic changes to the lives of every single Italian citizen. Basically, you are not allowed to go out, only for, going and doing some shopping for food or health reasons. For the rest, you are not allowed to go out. You are not allowed to travel, of course, from one city to the other. You need to stay at home. You need to stay at home alone with your family. And this is a radical turn in the lifestyle of every single Italian citizen. You rediscover many old activities. You feel, of course, constrained. But on the overall, I would say that today, Italians realize this is necessary, and so they are coping with that. Obviously, this is transforming and will be transforming the society. For once, we realize how important is the personal contact. We thought for a long time that digital transformation was going to transform our lives, but now we realize personal contact, physical contact is important. So you realize it when you miss it.
Absolutely, indeed. And lastly, just before I go, let you go, Mr. Marchetti, Italy is the third largest economy in the Eurozone. How badly do you think, the outbreak of the novel coronavirus infections is likely to impact the Italian economy?
It will have a serious impact. Obviously, this is not caused by economic reasons, but by health reasons. So it's a kind of an external variable that will disappear, hopefully, soon. But inevitably, there will be damages. Some companies will go bankrupt. The government is setting in place a kind of contingency measures to help those businesses, those companies to survive. We will see. The Italian government and also from yesterday, the European Commission promised and pledged substantial funding. This will be crucial because otherwise an important segment of the economy could be killed by this health problem.
All right, we'll have to leave there. Thank you very much indeed, Mr. Rafal Marchetti. Thank you very much indeed for talking to us.